Okay, welcome to another exciting part of nursing informatics. And here we're going to talk about administrative information system of chapter 13. So we're going to explore agency-based health information systems, evaluate how administrators use core business systems in their practice, and then assess the function and information output from selected information systems used in healthcare organizations. So you're like, oh my gosh, I don't know what you just said. Sounds like blah, blah, blah. But breaking it down. So we're going to look at health information systems. There's a million out there. Epic is used quite often in this area of Cincinnati. So that's one I tend to refer to. I would love to hear feedback from your guys' information system. How administrators use core business systems in their practice. So we're going to talk about informatics within business and how health administrators specifically use it in their practice, and then the function information output. So you have the whole idea about function and then what comes from that, and how it's used within a healthcare organization. So healthcare organizations integrate a variety of clinical and administrative types of information systems. And the systems collect, process, and distribute patient-centered data to aid in managing and providing care. And so you're like, all right, well, I know that. We do that all the time, right? We look at our outcomes and our processes, and it kind of helps us manage our quality improvement. And so what I really want to talk about is from an administrative point of view. And am I an administrator? No. But I think as we all move along and you think about becoming a leader, you think about just being a change agent, you kind of are an administrator. It's our responsibility if we want it. If we want to make changes, if we want things to improve, then you do have to take up these areas that, can kind of seem so daunting. I know for me, sometimes I'm like, it's not my problem. Like, just tell me what you want me to do and I'll do it. But sometimes we want things to change, we want things to get better. We have to understand how to get to this information and then use it. So case management information systems. This identifies resources, patterns, variances in care to prevent costly complications related to chronic conditions and then enhance overall outcomes for patients. So once a trend is identified, case management systems provide decision support, promoting preventative care. And I'm going to give you a little video to show you to better explain this, because this is actually the crux of the patient-centered medical home and really what is a hot topic in the healthcare arena right now.
System should present the information in such a format that it creates an impact on its user, provoking decision and action and investigation. The foundation of MIS is the principle of management and its practices. MIS is an art and science of gathering, collecting, storing, analyzing, and disseminating information for manageable decision-making with due regard to the people of the organization. The MIS has been defined in many ways as the system that provides information support for decision-making in the organization, an integrated system of man and machine for providing the information to support the operation, management, and the decision-making function in the organization. The system based on the database of the organization evolved for the purpose of providing information to the people in the organization. A computer-based information system. Role of MIS. MIS plays vital role in the management, administration, and operation of organization. It ensures that an appropriate data is collected from various sources, processed, and further sent to individuals, managers, and top management. It satisfies diverse needs through a variety of systems, helps top management goal setting, strategic planning, and involving business plans and their implementation. It plays an important role in information generation, communication problem, identification, and helps the process of decision-making. Impact of management information system. Moving on to the impacts of MIS. Management functions. MIS facilitates effective management of marketing, finance, production, and personnel. The functional management is informed about the process to achieve.
So it kind of gives you these decision support. So did A happen, then do B. If it didn't, then do C. And this is really helpful in case management and actually in any type of management for a patient. So care plan is a set of care guidelines that outline the course of treatment and the recommended intervention that should be implemented to achieve optimal results. Case management information systems are especially beneficial for patient populations with a high cost of care and complex health needs, such as elderly or patients with chronic disease conditions. Case management systems assimilate massive amounts of information obtained over a patient's lifetime by reaching beyond walls that we can't get to. And it's collected by the case management system and processed in a way that helps reduce risk, ensure quality, and decrease costs. And, you know, I'd love to say to you, yep, I use it all the time, it's so great. And it's a matter of capturing, right? Because each program is set to capture information, but it has to be done in a certain way, and if it doesn't, the computer isn't going to know it's there. So communication systems. This promotes an interaction between healthcare provider and patient. Communication systems have historically been separate from other types of health information systems and from another. So example would be call light systems, wireless phones, pagers, emails, instant messaging, which have traditionally been forms of communications targeted at the clinician. So integrating communication systems with clinical applications provide a real-time approach that will facilitate care among the entire healthcare team, patients, and their family. And think about us. So, you know, communication system, you're in online class, and so, you know, email, obviously, but texting, how great is that? You can text me and it's real-time support.
Infant security system. Patients. We provide nurse call systems, overhead paging systems, infant security systems. I've worked in healthcare for 15 years. We have about 40 years of experience in healthcare systems, information and communication systems. Some of the hospital communication systems we do are in places like full-blown scale hospitals, care centers, senior assisted living centers, and places like that. We install everything from small patient arrival systems to custom digital signage communication systems. The nurse call system we have behind us here is our flagship product for healthcare systems and can be scaled from small to large facilities. And it can help people with patient workflow, staff workflow, showing nurses where the staff members are, where equipment is. Nurses have a lot of responsibility. They have a lot of responsibility. And with our systems, we can help them by automating patient rounding. We can get communication from the patient to the nurse quicker and more efficiently, saving the nurse time. Lives are on the line with these systems. Communication is critical in hospitals because patients are relying on the nursing and the nursing is relying on these systems to get their point across and to get their communication solution met. One thing at Marshall Industries that we do, as we are honest with our customers, we will give them a communication solution that fits their facility and will fit their budget. When we first come to a hospital that requires some communication needs, what we will do is we will sit down with them and do a needs assessment. We'll analyze what they need and what systems they're looking for to accomplish that goal. That means hospitals need someone that they can depend on for their systems as well. And that's where we come into play. You will get a live person answering your phone call 24 hours a day that know these local facilities. The reason we are so successful in hospitals is because of our service and our priority on our customers and their satisfaction. One of the reasons we have local service is people can't afford to wait for someone to fly in from across the country. If you talk to one of our service people, they will know your facility. They won't be in a cubicle somewhere else. If you are a hospital or a healthcare facility and need communication systems and are looking for a reliable, dependable source for communication solutions, call Marshall Industries. I'd be happy to talk to you myself.
So that's just an example of, you know, a communication system, especially in call center, in patient care that is a little more accessible to the bedside. So I think it's just really good practice to understand all your options in terms of, you know, informatics and improving communication systems in your clinical